He's a board-certified family physician who utilizes the best of conventional and alternative therapies. He's a medical director for the Center for Holistic Medicine in West Bloomfield, Michigan. He has lectured internationally and authored 11 books. Please give a warm Academy welcome to Dr. Brownstein.
Well, thank you for having me, and I'd like to thank Rich Fisher for asking me to speak and putting on this great conference. And I'm still trying to figure out how I have to come to a dental meeting to learn something new, since most of my meetings are not this good. So thank you guys for putting it on, and you'll have 2 new members because I want to join before I leave. So I gave you Iodine Part 2 last time. Let's go back to Part 1. For those of you who are in Minneapolis, there'll be maybe the first 10, 12 slides might be repeats. After that, it'll be new information. And I'll take you through iodine, why it's the single most important thing that I think I do in my practice, and it gives me the biggest bang for my buck. And if there's one nutrient that I was restricted to using, it would be iodine, because I see the best benefits from this one single nutrient, although it's best used as part of a holistic treatment regimen than as a single nutrient. So these are the books that I've written. Again, we'll focus on iodine, and I'll touch on some of the other books. Now, when I left you in Minneapolis last time, I told you I was going to the Michigan-Notre Dame game. Got home, my daughter Jessie and I got in the car, traveled to Notre Dame, and we watched our quarterback throw 6 interceptions and lose the game. But this was when we were in a good mood before the game and trying to mimic touchdown Jesus over there, which was not good to us. That's because Denard did not take his iodine before the game, and he hurt his elbow, and it was a whole mess and whatever. And Notre Dame showed their true colors in that championship game anyways. So there's no better way to talk about iodine than this quote by Leo Tolstoy. He said, "I know that most men, including those at ease with the problems of the greatest complexity, can seldom accept even the simplest, most obvious truth, if it would oblige them to admit to the falsity of conclusions they have delighted in explaining to their colleagues." There's no more falsity of conclusions about any single nutrient than iodine. Iodine causes autoimmune thyroid illness. Iodine will worsen autoimmune thyroid illness. If you have a thyroid illness, iodine will make it worse. Those are all falsity of conclusions. I talked to you last time about iodine and autoimmune thyroid illness. Now we'll just talk about iodine and why it's so difficult what you can do about it. So this is my professor of endocrinology, chairman of the Department of Endocrinology at Wayne State University School of Medicine, Professor Vader. And they told us from day one of medical school, don't take iodine, it'll make thyroid problems worse, it'll cause autoimmune thyroid problems, and there's enough iodine in salt. Well, all that's wrong. And when I started learning about iodine and using it in my practice, he heard about that, and he called me up and asked if he could see me because he wasn't feeling good. So I said, well, if you come and see me, you got to take off your mask. And I made him take off his mask. And he didn't look good. And in my thyroid talk, I talk about how you can look for clinical signs of hypothyroidism, and he's got periorbital edema, and he lost his hair, and he's irritable. And so I did an iodine loading test. He was very low on iodine, and I put him on 50 milligrams of iodine, and I made him come back in 3 months, and that's the difference. So if that's what iodine can do for him, just think about what it can do for you. So medical iodophobia is a term coined by my mentor in iodine, Dr. Abraham. And Dr. Abraham wrote that medical iodophobia is the unwarranted fear of using and recommending inorganic, non-radioactive iodine within the range known from the collective experience of 3 generations of clinicians to be the safest and most effective amounts for treating the symptoms and signs of iodine deficiency from 12 to 50 milligrams per day. Medical iodophobia is rampant in the conventional world. It's rampant in the holistic world. And hopefully I'll dispel some of that today. This is when I met Dr. Abraham the first time. He taught me more about iodine than he'll ever know. He recently passed away, and he'll be sorely missed. And he was truly a pioneer in medicine, and certainly a pioneer with iodine. Edgar Cayce, the sleeping prophet, wrote there are only 4 elements in the body: water, salt, soda, and iodine. And he said if we have adequate amounts of these 4 elements in balance, the body is fully capable of creating all the other elements of the universe. There's no question we need adequate hydration. We need the right kind of salt, which is unrefined salt, and I'll touch on that during this talk. We need Diet Coke and iodine, and we're all set to go. But he probably wasn't referring to diet soda at that time since it wasn't developed. So what do you think he was referring to? pH balance, probably bicarbonate of soda. And really, in every patient I call this doing the basics, and I think iodine is part of the basics. Now, before I started using iodine, I would diagnose people with cysts and nodules in the thyroid, cysts and nodules in the breast, cysts and nodules on their ovaries, on the prostate, and through balancing the hormones and getting their nutrition status up and detoxing them from things like mercury, they would get better, but these cysts and nodules didn't get better until you corrected that with iodine. And this was a patient I saw where I palpated an enlarged nodular thyroid. I sent her for an ultrasound, and the ultrasound shows she's got a 1 centimeter nodule. She's got a few nodules, but a 1 centimeter nodule. Anything over 1 centimeter, I recommend getting biopsy to rule out thyroid cancer. She refused the biopsy. She was also really low in iodine. I put her on 50 milligrams of iodine. And 6 months later, I had her do another ultrasound. So this ultrasound was dated 5/18. This one's dated 11/29, and the conclusion here is previously described nodules not identified in the current exam. There's a continuum of iodine deficiency in the glandular tissue, where iodine's main responsibility is to maintain a normal architecture of the glandular tissue. So in the breast, the ovaries, thyroid, uterus, prostate, you have normal architecture of that tissue if you have adequate iodine. The first thing that happens when iodine levels are low is you start getting cysts. If it goes on, the cysts become nodular. If it goes on, they become hyperplastic. If it goes on, they become cancerous. And that's the iodine deficiency continuum. When you consider that 1 in 7 women have breast cancer, 1 in 3 men have prostate cancer, and thyroid, autoimmune illness, and nodules, and goiter, and cancer is occurring at epidemic rates, this could all be explained by iodine deficiency. And this was a study. Now, I was taught in medical school, don't give them iodine if they have autoimmune thyroid illness or growth of the thyroid, you're going to make it worse. Well, this study found both benign and malignant thyroid nodules have significantly less iodine than normal tissue. Benign nodules, 56% of the iodine content as compared to normal thyroid tissue. And malignant nodules, 3% of the iodine content as compared to normal thyroid tissue. Just the opposite about what I was taught in medical school. So we'll focus on the group 17 of the halides, fluoride, chloride, bromide, and iodine. Only 2 of those halides have known therapeutic values in the body, chloride and iodine. The other 2 have no known therapeutic value. And if we even throw out fluoride and say, okay, it helps teeth, which I'm on board with you guys on this one, but let's just throw that one out. Bromide has no known therapeutic value that's ever been shown in the body. And I'll show you, and I would show you if I had a little more time, that bromide toxicity is occurring in probably well over 95% of us. I mean, my testing and testing nearly 1,000 patients is everyone's toxic on bromide. Everyone has high bromide levels that I've tested so far, healthy or not healthy. So iodine was first discovered in 1811 by Dr. William Prout in London. In 1820, Coindet reported efficacy in treating goiter. He recommended iodine pre-op to diminish goiter size and vascularity. However, he encountered stiff opposition with opponents claiming iodine was poisonous. There were reports that he wouldn't leave his house for fear of being stoned in the street. Now, those of us that promote iodine know there's others out there throwing stones at us. Even our holistic comrades are throwing stones at us. But that's just because they're not familiar with the biochemistry of iodine and the physiology and how it reacts physiologically in the body. So iodine could be known as the birth of Western medicine, since Boussingault in 1824 observed that miners who went into the mine with goiter who drank the water that was in the mine, the goiter went away. He ascertained it was the iodine from the salt in the mine that got in the water that caused the swelling of the thyroid to go away. So he wrote that people should drink either iodine from water or salt that has iodine in it to people who have goiter to get rid of goiter. So it was really the use of a single item, iodine, was recommended for a single problem. It was the first time. In medicine, we're taught how to diagnose pathology and how to prescribe the one drug to treat it, which would go along with this maybe being the birth of Western medicine. So the RDA for iodine is about 150 micrograms a day for men and women, a little bit more in pregnancy and lactation. However, I will show you, I think a better acronym for the RDA is rats, drugs, and assumptions. Really dumb advice might be another one. It may be enough to prevent goiter in the vast majority of people, but it's not enough for the breast, the thyroid, the uterus, the prostate, the skin, and every other cell in the body that needs and requires iodine. So iodine levels have fallen over 50% in the last 40 years. From 1970 on, iodine levels, according to the NHANES study, have been shown to be declining. During that same time iodine levels have been declining, we've seen epidemic increases in thyroid illnesses, hypothyroidism, autoimmune thyroid illness, and thyroid cancer. For those that claim that iodine is causing these problems, I'd like them to, as Ricky said to Lucy, explain that. Because there's no explaining that. If iodine were causing these problems, as iodine levels fall, you would see these conditions falling. Same thing with cancer of the breast, prostate, endometrium, and ovaries. All those conditions are occurring at epidemic rates, and they can all be related to iodine deficiency. The proportion of the U.S. population with moderate to severe iodine deficiency, according to the World Health Organization, has increased 300% in the last 40 years. I got the numbers on that slide for you, and if we graph it out, it looks something like this. Now, you would think that since we know that iodine prenatally is crucial for the baby to develop his optimal IQ potential, that we would ensure that pregnant women are getting enough iodine before they become pregnant. However, that's just not happening. The studies show that over 70% of women may not be getting enough iodine, and I'll show you some other studies with that. Here's another study, 16.8% of U.S. women moderate to severely iodine deficient. 35.8% were moderately deficient in iodine. What about those mildly deficient? I say it's a recipe for disaster for our country. And if we graph it all out here, you can see mild, moderate, and severe is here. 60% of women of pregnancy age are deficient in iodine. I mean, this is just a disaster. And I'll show you in coming up how iodine might be related to ADD and autism. We're seeing kids with all these behavioral disorders. Maybe we're just missing the boat nutritionally, and we should be certainly correcting iodine levels. 3 groups of children. Group 1 was supplemented at the first trimester, 4 to 6 weeks of gestation, with 200 micrograms of potassium iodide. Group 2 was supplemented at the beginning of the second trimester, and Group 3 wasn't given iodine until after birth. So here's the T4 levels, free T4 levels in the newborns. And this is normal, this is abnormal. So you've got 40 plus 20, you got 60% normal and 40% abnormal. This was the ones given iodine after birth. Here's the ones given iodine in the second trimester at 12 weeks gestation. They're all normal. Here's the one given iodine in the first trimester at 4 weeks. Now these numbers are pretty impressive, showing the thyroid function of the baby will be much better if you give them iodine earlier in the pregnancy. But the more important thing is we want to ensure the baby develops their potential, their potential for IQ. They can maximize their IQ. And in these groups, here's Group 1 given iodine first trimester. Look at the difference between Group 2 given iodine about 10 weeks later. That's a normal child who's going to finish high school, go to college, reach their potential. This one's going to probably finish high school, and that'll be it. This one's probably going to have trouble finishing high school, trouble holding a job. Now, this is Denard Robinson, who just graduated from the University of Michigan, scoring a touchdown against the probation, cheating, lying Ohio Buckeyes. And, they're so proud of their record this year, but I would like to know what bowl game they won. And I don't recall them playing in a bowl game because they got caught lying and cheating and all that stuff. And we're just waiting for the other acts to fall on them. But when Denard takes his iodine, look what he does. He doesn't throw 6 interceptions. He wins the game. When he doesn't take his iodine, 6 interceptions, and I drive 3 hours each way to watch it. So a meta-analysis of 18 studies of children and adolescents found iodine deficiency was associated with a 13.5 point lower IQ score in children and adolescents. This difference in IQ is a difference of a child meeting their potential in life and a child struggling through life. 133 pregnant women receiving 300 micrograms of iodine during the first trimester, compared to 61 pregnant women not supplemented. The thyroid and iodine lab tests on the mothers and children, as well as neural psych tests performed. You know what? I'm sorry, I missed a slide on there, but basically showing that the IQ went down. And you know what? I am on my wrong presentation here. Hang on one second. No, I'm on my right one. I thought I deleted those slides. I apologize about that. So, iodine deficiency is a worldwide problem. It causes mental impairment, reduced intellectual ability, ADD, and autism. Iodine in causing goiter has been known for over 100 years, causes infertility, and increased risk of problems in all the glandular tissue. And unfortunately, all these things are going on at epidemic rates right now. The newborn thyroid only holds a 24-hour reserve of iodine, therefore fresh sources must be supplied in the diet. And the only source for newborn who's breastfed is mother's milk. And 47% of women sampled are providing insufficient iodine to meet the infant's requirements from this study from Journal of Endocrinology and Metabolism. 13 lactating women with breastfed infants, none were taking iodine supplements. The mean iodine concentration was 56 micrograms per liter. That is, according to the World Health Organization, moderate to severely deficient in iodine. Another study, 13 breastfeeding women, 92% had inadequate iodine, but 69% were high in perchlorate. Perchlorate is a byproduct of rocket fuel manufacturing and other manufacturing processes. It's a chlorine derivative. And recall from the periodic table, chlorine derivatives can competitively inhibit iodine, just like bromine can. And the government has allowed people who make perchlorate as a byproduct to just dump it into the sewers, and it doesn't get fully taken out of our water supply. The authors were dismayed to note that while little of the maternal iodine finds its way into milk, the bulk of the perchlorate ends up in milk. So we got a mess on our hands with iodine, and it's not just chlorine derivative, it's bromine, as I mentioned at the beginning. The bromine is used as a fire retardant. It's in carpets, it's in curtains, it's in computers, it's in iPods, it's in baby clothes and baby furniture. And recent studies show it's not even a fire retardant. Just the bromine manufacturers paid for the original studies, and they fudged the data to make it look like a fire retardant. In this study, the average level of bromine-based fire retardants in breast milk of 21st-time mothers was 70-fold higher as compared to the average found in European studies where they've outlawed bromine. We haven't outlawed bromine here as a fire retardant. And U.S. mothers had the highest levels of bromine-based fire retardants ever detected worldwide. So we got a double whammy for our babies going on where the mothers aren't getting enough iodine, and yet they're getting all these toxic halides, particularly fluoride and bromide, at huge amounts. Between 1965 and 1980, U.S. milk iodine increased by over 300 to 500% due to changes in cattle feed. By 1986, the government limited that, and you can guess what happened to iodine in dairy products. It's gone down significantly. So why look at iodine? 1.9 billion individuals worldwide are estimated to have inadequate iodine nutrition. The WHO claims iodine is the greatest single cause of preventable mental retardation. The WHO estimates there are 300 million school-age children worldwide who are iodine deficient. That includes 36% of all school-age children, including our school-age children. Over half of the population of Europe lives in areas of iodine deficiency. And 1/3 of the world's population lives in an iodine deficient area, including much of the United States. That includes 129 countries. There's decreased childhood survival rate in iodine deficient areas, and neonatal mortality has been shown to decline over 50% when iodine deficiency is rectified. When I started residency in the 90s, late 80s, early 90s, they started to put NICUs up, neonatal ICUs up in all the hospitals to decrease neonatal mortality. Now all these suburban hospitals have NICUs. We haven't decreased neonatal mortality one iota over these years. And we have one of the worst neonatal mortalities of any Western country right now. And I say it's because we haven't addressed the underlying problem, which is nutritional and hormonal problems, particularly iodine. 72% of the world's population is affected by iodine deficiency. 100 consecutive healthy pregnant Bostonians. 50% were found to be below the RDA. 9% were below severely iodine deficient amounts by the World Health Organization. And we've got autism, which has gone from 1 in, I believe it was 1,300, 10 years ago, to 1 in 88 now. And I have no doubt that autism is being caused by our toxicities. It's been caused by nutritional imbalances and hormonal imbalances. And I say iodine should be part of that discussion with it. And it's similar to the U.S., a pattern of iodine decline in a population and a concomitant increase in autism has been seen in many other Western countries. 16 women from an iodine deficient area of Italy compared to 7 women from a higher iodine area. The women from the iodine deficient area had reduced T4, that's thyroid hormone, decrease of free T4, with slightly elevated TSH in 50% of pregnant women. The authors hypothesized the imbalance of maternal thyroid hormone homeostasis during pregnancy as a consequence of endemic iodine deficiency may be responsible for the impaired psychoneurological development observed in children from that area. Appropriate iodine and or thyroxine prophylaxis to women in that region may prevent the neurobehavioral, cognitive, and motor compromise of that population. I agree with this study. What I would disagree with is that highlighted line. If you give someone thyroid hormone who's iodine deficient, you increase the body's need for iodine, and you make iodine deficiency worse. There are studies that show that women who take thyroid hormone for 10 years have a 50% increased risk of breast cancer compared to women who aren't taking thyroid hormone. The only way to justify that is that they're not treating the underlying cause of the thyroid problem in the first place, which is iodine deficiency. That needs to be treated first or concurrently with thyroid hormone before putting someone on thyroid hormone. That's a shift from the way I used to do things 20 years ago when I learned about iodine 10 years ago. I used to put them on thyroid hormone first. Now I don't. My use of thyroid hormone has gone down markedly since I've learned about iodine and been using iodine. Another study, 16 women living in an iodine deficient area versus 11 women living in an iodine sufficient area. After 10 years of follow-up, ADD was diagnosed in 11 of 16 in the iodine deficient area versus 0 in the iodine sufficient area. The more telling number was the IQ was lower in the iodine deficient area, an IQ of 88 versus an IQ of 99 in the iodine sufficient area. Now, I went to the University of Michigan. How do you know someone graduated from the University of Michigan? They'll tell you within 30 seconds of meeting you. I went to the University of Michigan, and an IQ of 99, you have to work hard and do well on your exams, and you might get in. An IQ of 88 guarantees you're not getting in. Now, we don't want that. We want kids to reach their potential. So if they can't reach their potential and they have low IQs, they end up in places like this. And if you want to go here, that's your business. You want to be with a bunch of cretins and a bunch of subnormal IQ people, that's fine. But here's an example of a cretin. And he's got a stupid look on his face. His nose is flattened in. He got his butt beat in by another mascot, or last year or the year before from Ohio U. And this is a typical cretin. If you want to be a super cretin, this is a super cretin. Stupid look on their face. They got this big head with no brains in it. But if we want iodine deficiency, there's iodine deficiency right there. You take iodine, you beat Notre Dame 2 years in a row. You don't take iodine, I drive 3 hours, and you throw 6 interceptions. Not good. And if you take iodine, good things can happen. You can be elevated in the world and reach your potential, which you should have reached last year when I drove 3 hours each way in the rain, and we got wet, and it was cold, and we lost. So, high cholesterol. I'm taught in medical school high cholesterol is a problem. It causes heart disease, and you need to use statin drugs to treat it. I've written about that in my Drugs That Don't Work book. That's a nonsensical argument. But the high cholesterol hypothesis started in the early 20th century by a Russian researcher, Anishkov, who fed rabbits cholesterol. The rabbits developed fatty streaks in their aorta, and he said, compared to rabbits who weren't fed cholesterol, who didn't have the fatty streaks, he said cholesterol causes heart disease. Well, it's kind of a bogus study probably from the beginning because rabbits don't normally eat cholesterol. But what's not reported is a few years after his research, in 1918, researchers demonstrated that feeding iodine to rabbits could prevent the deposition of cholesterol in the arteries of rabbits that were fed cholesterol. Those studies were reproduced and similar results reported in the literature 4 times. Here's one of them. They looked at the development of atherosclerosis in rabbits from a control group of rabbits fed a high cholesterol diet, a treatment group of rabbits fed high cholesterol diet and treated with either thyroid hormone, desiccated thyroid hormone, which is natural thyroid hormone made from porcine thyroids, such as Armour thyroid or Nature thyroid, or iodine. The controlled rabbits fed cholesterol developed marked aortic atherosclerosis, just as Anishkov's study showed a few years previously. However, the rabbits fed a cholesterol-rich diet and thyroid hormones showed slight to moderate aortic atherosclerosis. The rabbits fed a cholesterol-rich diet and either desiccated thyroid or iodine showed no atherosclerotic lesions. So this study showed that iodine has an independent positive benefit in a cholesterol-rich diet as well as a synergistic effect with desiccated thyroid hormone. We live in a wealthy Western society. We have a lot of cholesterol in our diet, as all wealthy Western societies do. However, what we're not getting is iodine right now. And I think that's why you're not seeing all these statin drugs, well, the statin drugs are the wrong mechanism, but that's another talk I can give you. But I think we're not seeing a decline in heart disease because we're not treating the underlying cause, which is a nutritional and hormonal imbalance and toxicity. And I would say iodine should be a linchpin of that treatment. So rats fed an iodine-deficient diet versus an iodine-sufficient diet. An iodine-sufficient diet resulted in a much lower thyroid weight, 4-fold lower. When the rats were fed a high cholesterol diet, their thyroid weight significantly increased in both groups. The high cholesterol diet was found to increase the body's excretion of iodine. So not only are we eating a healthy Western diet with a lot of cholesterol and we're lacking iodine, it increases our need for more iodine. Our iodine requirements have gone up over the years due to increased toxicity and increased exposure to toxic halides, such as bromine and fluoride. It hasn't gone down, and we're getting less. Iodine deficiency in rats in this study resulted in a subclinical hypothyroid picture of slightly elevated TSH with normal T4 and T3. And despite normal T3 levels, cardiac tissue was found to be deficient in T3. You couldn't correct that with just thyroid hormone. You needed to give them iodine to correct that intracellular deficiency. 136 subjects, they looked at iodine intake and lipid parameters. Compared to iodine-sufficient, non-goitrous controls, the iodine-deficient goitrin means just swelling of the thyroid. They had significantly higher cholesterol levels and LDL cholesterol levels. Well, so the first thing you find when you go to your doctor if you have high cholesterol and LDL levels is they want to put you on a statin medication. No. They should be talking to you about diet. They should be talking about nutritional and hormonal imbalances and toxicity things, clearing that up, and cholesterol will naturally come down. One of the first thing the body does when it's exposed to mercury is what? Raise cholesterol levels. Why does it do that? It tries to protect the neurologic tissue from the damage from toxic heavy metals. The last thing in the world you want to do in this case is lower cholesterol levels. Treat the underlying cause, not just the symptoms. Ansel Keys in 1958 published data the countries with the highest cholesterol levels had the highest rate of cardiovascular disease. At that time, Finland had the highest rate of cardiovascular mortality in Europe, and it was more prevalent in Eastern versus Western Finland. So researchers looked at a variety of dietary components, proteins, fats, carbs. They looked at 47 different items. Iodine showed the greatest statistical difference between Eastern and Western Finland. The risk of death from heart disease was 350% higher in individuals with goiter, and there was a significantly lower death age in those with goiter. So they don't wait 100 years like we do here to do things. 20 years later, they relooked at their increasing, they had the highest rate of heart disease in Europe at the time, so they relooked at their studies. And now they looked at the prevalence of cardiovascular disease in 21 Finnish cities as it related to trace elements in the drinking water. And they looked at, mostly the halides. And their endpoints were cardiovascular endpoints. And what they found was the strongest correlation was iodine, the highest iodine intake associated with the lowest rate of cardiovascular disease. So what did they do? They increased their iodine intake in its population by adding more to salt and more to the dairy feed, and their cardiovascular mortality has decreased by over 50%. Life expectancy has increased by 5 years. Finland currently has the highest iodine intake of any European country. They've gone up in their iodine intake. We've gone down during the same time period. 262 children in Morocco in an iodine-deficient area. They all have elevated TSH. They were given 400 milligrams of iodine. And after 6 months, there was a decrease in TSH, decrease in C-peptide, which is a measure of insulin release in the body, and their LDL over HDL ratio fell to normal. And the authors say correction of iodine-associated subclinical hypothyroidism improves the insulin and lipid profile and may reduce the risk for cardiovascular disease. Look, I say the first thing when cholesterol levels are going up, it's like an idiot light that should be talking to whoever's reading those tests. Something's wrong. Why is it out wrong? Do they have mercury toxicity? Do they have nutritional imbalances? Do they have hormonal imbalances? Are they eating poorly? Treat that stuff in the underlying cause first before relying on drugs which just block things down. And that goes with diabetes as well. Now you would think that we would take care of this with at least prenatal vitamins would contain iodine. Not true. Most prenatal vitamins don't contain iodine. You're probably thinking what Mr. Pyle's thinking here. Golly, how can that be in 2013? But only 28% of prescription prenatal vitamins presently contain iodine. The average iodine content of iodine-containing prenatal vitamins was below the RDA for iodine. And of the prenatal vitamins that do contain iodine, only 15% have more than 150 micrograms per day. I say it's a public health disaster that's unparalleled. The consequences of this is 1 in 88 kids have autism. We got ADD going through the roof. We got all these childhood illnesses going on strong, and we're going to have a population of kids who aren't going to be able to take care of us when we get old because they're going to be unable to do it. I call this study prenatal iodophobia because I get criticized from my colleagues. You're telling people to take too much iodine, and this is one of the studies they quoted. So it wasn't titled prenatal iodophobia, of course. That's my own title for it. But they looked at 3 groups of pregnant women. 168 women were taking prenatal vitamins, 150 micrograms per day of iodine from early pregnancy. 105 women were using iodized salt on questionnaires. And 160 women were not taking prenatal vitamins or using iodized salt. They looked at thyroid levels, and they compared the thyroid levels in the different groups. And what they found was the TSH increase in group 1, who were getting the RDA for iodine. So they had a slightly increased TSH when they were doing this, maybe because of a transient stunning effect on the thyroid. So they concluded that iodine is causing problems even at this dose, because it was causing this transient stunning effect on the thyroid. Now, I don't really know what a stunning effect on the thyroid. Maybe the iodine was hiding behind a corner. When the thyroid peaked out, it said boo, and it stunned the thyroid. But who's using iodine out there? And for the medical doctors who's checking blood levels, what's one of the first things you see when you put someone on iodine that may cause you concern with their thyroid function? TSH goes up. I talked to you about this in Minneapolis. It's normal and expected for TSH to go up when you put someone on iodine because Dr. Fletches will talk to you after me that they need to get iodine into the cells carried by a symporter called sodium iodine symporter so they can make more thyroid hormone. You would expect this to occur, and that happens. TSH goes up for about 3 to 6 months on most people and then comes down, and it's not a problem. And if someone knows iodine biochemistry, they'll be able to predict this and to understand this. But for those who don't know it, they'll talk about idiotic things like a stunning effect on the thyroid. I say, this is what they said, this transient stunning effect on the thyroid. I say wrong. The observed TSH increase is normal and appropriate response to iodine supplementation. The markedly lower rate of low free T4 levels provides further evidence of the benefits of iodine supplementation. Iodine needs to be treated first or concurrently with someone with thyroid hormone before putting them on thyroid hormone. 149 women at 6 months postpartum versus 98 controls, followed for 12 years. There's not too many studies followed for 12 years. So 12-year study I think we should give a little more pause to and a little more thought to. They looked at urinary iodine at 6 months postpartum in both groups and thyroid function at 12 years follow-up, and they correlated them. And what they found was that 12 years later, those who had the lowest iodine at 6 months postpartum were significantly higher than those who had normal iodine levels or higher iodine levels. So you had almost 45% who were hypothyroid 12 years later versus 10% hypothyroid in the higher iodine level. So we need to treat this before they become pregnant. We need to treat this in the youngest population that we can, and we need to reverse this decline. So iodine's great for balancing the pH. It's a great alkalinizing agent for the body, especially when you use it with unrefined salt. I've written a lot about salt, and I wrote a book about salt, is using salt as part of a therapeutic agent in the body. And you need to use the right kind of salt, not refined table salt. You need to use unrefined salt with minerals in it. Its deficiency causes intellectual deficiency, goiter, hypothyroidism, autoimmune thyroid illness, thyroid cancer, and other cancers. It's necessary for the production of all the thyroid hormones. It's necessary for production of all the hormones of the body. You can't make a hormone in the body without iodine. That includes the adrenals, ovaries, testicles, and all the other glandular tissue. And as I mentioned before, it's responsible for the normal formation of the architecture of the glandular tissue of the breast, thyroid, ovaries, and probably the prostate, although the studies haven't been done as extensively as the other tissues. So iodine's a trace amount found in small amounts of the body. It can be found in seawater and sea organisms such as seaweed, and it can be found in the soil near the ocean, and those plants grown near the ocean might have a little bit more iodine than plants grown in the interior of the country. And we know iodine can combine with salt. So the therapeutic actions of the most misunderstood nutrient are, it's a great alkalinizing agent, particularly when you combine it with unrefined salt, and it's a great pH balancer for the body. There's no bacteria that's been shown to be resistant to iodine. You guys talked a lot about, mouth bacteria. I'd be interested when you start using iodine and getting iodine levels up, if that shifts the mouth bacteria. Cancer, iodine has apoptotic properties that can turn cancer cells back in time from rapidly dividing to normal cells. There's only a few nutrients that's been shown to do that. There's no fungus that's been shown to be resistant to iodine. There's no parasites that have been shown to be resistant to iodine, and no virus that's been shown to be resistant. It's a great detoxifying agent. George is going to talk about that next. Iodine can certainly detoxify very well for chlorine derivatives, for fluoride, and for bromine. And for some patients, mercury, aluminum, arsenic, lead. Iodine has a chaotropic effect, which George will educate us all on next. And it's a great mucolytic agent. Not bad for the most misunderstood nutrient. Who's this doctor? Dr. Brown from Back to the Future. He built a time machine. He was a very smart man. He says, "Great Scott, maybe we should all be using iodine." Certainly couldn't agree with him more. You guys haven't talked about biofilms this time, but I just wrote my April newsletter on biofilms. And biofilms are common in joint replacements, dental implants, and root canals. You guys maybe can educate me. What I've read is every dental implant and every root canal develops biofilms. Biofilms protect organisms, resulting in resistance to antimicrobial agents. There's significant morbidity and mortality with them. And iodine's found to have anti-biofilm activity at low concentrations. And if I had more time, I'd go into the biofilm with iodine. But I would certainly say, anyone who's got a root canal or an implant, iodine should be paramount and it's part of your therapy to maintain, adequate iodine levels to prevent the biofilm formation. So here's a who's who of conditions treated and prevented with iodine. This isn't complete, but this is a lot of patients out there. So there are different forms of iodine out there. Iodine's not very soluble in water. In 1829, Dr. Lugol found that when potassium iodide was added to water, it increased the solubility of iodine. He came up with Lugol's solution, where 2 drops were 12.5 milligrams of iodine. And this was used over the counter throughout the United States from the 1820s on until the FDA, in its infinite wisdom, took it off the market about a year and a half ago and made it an RX item. So in the 1800s, Lugol, in the early 1900s, Lugol was widely available at most apothecaries. It was recommended for almost any condition. At that time, the number one cause of death was infection, and that's what doctors were mostly prescribing it for. And it was probably the most used medical item before patent medicine took hold. Once patent medicine took hold in the early 20th century, iodine fell out of favor with doctors. Just to remind you of the iodine, 150 micrograms for men and women. It's a rare element, 62nd in abundance of elements of the earth. And the reduced form of iodine is iodide, and it's got an extra electron in its outer compartment, which gives it a full complement of electrons. Here's iodine lacking an outer electron. That's the oxidized form. So one of the most important things Dr. Abraham taught me was that iodine and iodide bind to different tissues of the body, preferentially. So iodide, the reduced form, thyroid, salivary gland, skin. Iodine, the oxidized form, the breast, prostate, stomach. We don't know where it binds to for the rest of the tissue because the studies haven't been done, but it doesn't take rocket science to realize if you want a whole body effect from iodine, which one are you going to use? Both. You want to use a combination of the two. That's where Lugol's solution comes in. That's where tableted Lugol solution in the form of iodoral would come into play. There's only 2 tableted ones that I know of that contain both. It's either iodoral or iodozyme HP from Biotics. So where's iodine found in the body? Every cell in the body contains and utilizes iodine. The white blood cells can't effectively guard against infection without iodine. It's concentrated in the glandular system. The thyroid contains the largest at saturation, 50 milligrams. However, all the tissue, especially the glandular tissue, concentrates iodine against the gradient. It's transported across the cell via the sodium iodine symporter. I talked to you about this in Minneapolis. 600 micrograms per day can get across into the thyroid. If your goal is to maximize iodine intake in the thyroid, so you want to ensure someone has good thyroid function, now you can see why the RDA truly might be for rats, because it's not enough. And certainly not enough in the toxic world we live in with the fluoridated water supply and all the bromine fire retardants we're exposed to. At saturation, there's about 1.5 to 2 grams stored in the body. The fat stores the most, muscle second. The thyroid is there for comparison. However, the thyroid has the highest concentration of iodine. The first U.S. iodine studies were done by David Marine, and at the turn of the 20th century, as the U.S. was expanding from east to west in their population, there was a goiter epidemic. And the U.S. was aware of the earlier studies in the 1800s by Boussingault and Coindet and the others who said that iodine can treat goiter, but they didn't quite know how to get iodine into the food supply. So David Marine had written a paper about iodine in medical school. He became the de facto expert at the time. The U.S. government hired him to do a study on farm animals. And the reason they looked at farm animals first was the farm animals were getting goiter just like the humans were, and the farm animals weren't growing to the right size and weren't procreating correctly. And there was a worry that as the U.S. population expanded, we were going to outstrip our food source, the animals, because they weren't procreating correctly. So he looked at iodine results in farm animals by putting different amounts of iodine into their feed, seeing where they grew correctly, where the goiter stopped forming, and they began procreating correctly. He picked the minimum amount, estimated how much humans needed, and said, that's what humans need to take. So his first study on people was done in Akron, Ohio. At that time, 56% of school-age girls had goiter. There was a higher incidence of puberty. The reason there was a higher incidence of puberty is the breasts are the third highest concentration of iodine in the body behind the thyroid and the ovaries. And as girls start to form breasts, their iodine requirements go up immediately. And there was a 600% increase in goiter in girls versus boys in Akron, Ohio at the turn of the 20th century. So he looked at two groups of school-age girls, a control group, no iodine was given, a treatment group of 9 milligrams of iodine daily for 2.5 years. This is over 100 times the RDA for iodine. And what side effects did he report from this dose? None. What he found was 22% goiter in the control group and 0.2% goiter in the treatment group. Now, I just told you 56% of these had goiter before he did the study. How come it's down to 22%? My only explanation for that is this group probably heard about how this group was feeling and doing, and they were doing better, and they probably said, screw it, I'm going to take some iodine, I'm not waiting until the study. But still, these are pretty big differences in numbers, but I'm sure that's why the difference between what was expected and what he found. But still, that's 22% versus 0.2% is a big difference. So he repeated the studies in Michigan shortly thereafter, found the same issues and the same response. By 1928, they had introduced iodized salt to the area, and goiter had decreased by 75%. The United States added iodine to salt for the rest of the country. It was hailed as the first public health miracle, which it was. And a lot of the interest in iodine faded after that. They thought they had it taken care of by just adding iodine to salt. This was a map of World War I recruits before iodized salt and goiter. And now I would assume most of these are men, and the whole country suffering from goiter in varying amounts. The black was the worst. So how do you get iodine in? It's not common in most foods. It's in ocean foods, such as sea vegetables and some ocean fish. However, it's only in sea vegetables if those sea vegetables are grown in clean areas of the ocean without bromine tossed on board. If bromine's tossed on board, the sea vegetables will gather bromine just like we will, since they have the same sodium iodine symporter. And it can be found in food products if iodine's added to the animal feed of the food source, such as salt. So it took the U.S. 100 years to add iodized salt, even though Boussingault recommended it. That's why I say they're 100 years behind what we're all doing here. So it'll take them 100 years to stop using amalgam fillings. And then they'll say, well, we've been doing that forever. We knew that for a long time. So 74 micrograms of iodine per gram of salt in iodized salt. It's a cost-effective way to prevent goiter. However, it's inadequate to provide for the body's need for iodine. It doesn't provide enough for the breast, the ovaries, uterus, prostate, skin, and every other cell that requires iodine, which is every cell. This was illustrated by Pittman. In 1969, he looked at two groups. Group 1 got iodized salt, Group 2 got iodized bread. They both got that amount of iodine per day, 750 micrograms per day. Iodine's a neat substance because almost 99% is cleared through the urine when you take it orally. So you can study intakes and outtakes and figure out how much the body's holding on to. Knowing the renal clearance, which is 42.5 liters per day, you can calculate numbers and say an expected result from taking this much iodine should be a serum level of 17.2 micrograms per liter. But what did Pittman find? Here's the expected result, here's the bread result, and here's the salt result. Only 10% of the iodine in salt's bioavailable. It's not a great way to get iodine in our body. It might be enough to prevent goiter in the vast majority of us 20 years ago. It ain't anymore. because I can tell you goiters increase at epidemic rates. The only reason it's not being reported is doctors can't palpate it anymore. They don't know how to do it, and they're not good with their hands. They just order blood tests and palpate with the stethoscope in front of their hands, which doesn't work for trying to feel a goiter. I'm sure George would agree with me, goiter is increasing at epidemic rates over the years because he's good at palpating the thyroid as well as I am good at palpating the thyroid. So, is iodized salt not a good source of iodine because of inhibition by chloride in salt? I doubt it. We have over 100 grams of chloride in our body. Chloride's a necessary element in our body. We can't live without chloride. It's other things in salt, which I talk about in my salt talk and salt book. Ferrocyanide, there's aluminum silicate that I'm sure are inhibiting it. And there's chlorine derivatives, but I don't think it's the chloride in salt. But still, many doctors will say, just you get enough iodine in salt. And I say, who are these doctors? Who would still recommend using iodized salt? Well, here's 3 of them. Drs. Howard, Dr. Fine, Dr. Howard. But although I like them very much, and my wife and daughters can't stand when I have this on TV and I'm laughing at it. I don't know why they get angry with this, but they just don't understand humor. But we don't have to be like Dr. Howard, Dr. Fine, Dr. Howard, because they weren't the greatest doctors. And once you learn about salt and the right salt and the benefits of salt, you can start recommending to your patients, and particularly for those of you doing mercury detox and removing mercury fillings, ensuring adequate salt levels helps all the detox pathways. So, iodine levels have fallen over 50% in the last 30 years. We already went through this. Cancers, thyroid problems, and all the endocrine problems are going up at epidemic rates. Iodine can't be causing this stuff. It would just be the opposite occurring. First 250 patients I checked, 94% were low in iodine, significantly low in iodine. Here's the first 24. That red line is sufficient. Only 2 met it. Here's the next 26. I went on. Now we've checked over 5,000 patients. In a month, we'll be over 6,000 patients between the 3 of us. And our numbers are holding steady. It's 96.4%. I'll do another calculation when we cross over 6,000. Are low via urine or serum. And I would say the majority of them are severely low. So why? Well, the soil is deficient in iodine. It occurs in inland and mountainous areas such as the Midwestern United States where I live. However, soil erosion from glaciers, deforestation, and poor farming techniques deplete the soil of iodine. And the big problem we're seeing right now, why our iodine requirements have gone up, is that last bullet, pollution. Pesticides and insecticides generally contain toxic halides, bromide, fluoride, or chlorine, and it's sprayed all over the place. It's sprayed on our food, it's sprayed on the animals, and this gets right back into our food supply. There's not a lot of iodine in common foods. Now, hopefully you're asking yourself, as Ricky asked Lucy, what happened? What happened with this? What's the consequences of iodine falling? It's the increase of thyroid problems, breast cancer, ovarian cancer, uterine cancer. But why are people iodine deficient? They don't use iodized salt. They're afraid of it. We've been taught it causes hypertension, which is nonsense. I would love to give you guys a talk on that one. And presently, they estimate less than 50% of U.S. households use iodized salt. I'll bet that number is way lower than that. I would guess less than 30%. Radioactive iodine use in medicine only works in an iodine deficient state. It doesn't work in iodine sufficiency. But you can get chemical exposure to goitrogens are increasing, such as bromine, chlorine, and fluoride. They're in drugs. Prozac has fluoride in it. There's asthma, inhaler medications that have bromide in it. There's a bunch of medications that contain these toxic halides. Nitrates, perchlorates, thiocyanates, all increasing in our environment. They're a competitive inhibitor of iodine. And we have declining mineral levels in general, but the main reason is it's in our food supply. Now, soy, I was at a lecture and, I get that Sunday paper and I'm reading this on the plane and it says iodine deficiency is rare in this country. Well, maybe they meant to say the steak looks rare, but iodine's only rare if you're not looking for it. If you don't look for it, it ain't rare. So soy, non-fermented soy such as soybeans, soy milk, soy dogs, soy cheese, is a goitrogen. It blocks iodine absorption into the thyroid, and it's a known goitrogen. These are the supplements that contain daidzein and genistein. Any supplements that contain those should be avoided. And when low iodine levels are present, these soy compounds block thyroperoxidase catalyze tyrosine iodination by acting as alternate substrates. They produce monodi and triiodosoyflavones, which further worsens iodine deficiency, and it can occur with lower intermittent doses of iodine. I tell all my patients to avoid non-fermented forms of soy. I see a lot of thyroid problems. They're not correctable while they're eating this form of soy. I recently, last Friday, I did a deposition for prisoners in the Illinois State Penitentiary because they've changed their food supply. Instead of, they've increased their soy content through soy meat. They took all their meat out and just gave them that fake soy meat. So these poor prisoners developed all these thyroid problems. They all got fat. The men got breasts. They felt miserable. And the Western Price Society put up the money for their lawsuit and sued the Illinois Department of Corrections. And it's moving forward. And if this goes through, this could be a big deal because maybe this will finally start to get soy out of the diet because they're putting soy in everything. And these prisoners are perfect examples of what happens when they change their diet. Dietary reasons for iodine deficiency are diets without ocean fish or sea vegetables, inadequate use of iodized salt, including low sodium diets, makes it worse. But my premise is you can't even get enough iodine from iodized salt. Vegan and vegetarian diets notoriously deficient in iodine. And bromine in food and drinks. There's bromine in vegetable oils such as Gatorade products, Mountain Dew, and other soft drinks. It's in bakery products, breads, pasta, and cereal. So in the 1960s, iodine was added to bakery products as a conditioning agent. One slice of bread contained the RDA for iodine. In the early 1970s, bromine was substituted for iodine. Why? He asked why. Well, I say, I can't answer why yet, but I say it creates a double whammy in the body. It worsened an iodine deficiency problem, which was already occurring, and it competitively inhibited iodine in the body by adding a known goitrogen to bakery products. Why would you pull out a necessary nutrient, an essential nutrient for the body, and put a goitrogen in? I can't answer you. I don't know why. I have my feelings with it, but I say it's the most asinine act amongst many in the history of the food industry. My feeling is that it was done right at the time radioactive iodine use in medicine became starting to use. Radioactive iodine use in medicine doesn't work if people have enough iodine because the radioactive iodine spills right through. If we get hit with a nuclear attack, they're going to give us all iodine pills to take so the radioactivity goes through our body. Well, they can't do their medical test without it. And maybe there's a reason they want us a little bit iodine deficient. Not a little bit, a lot iodine deficient. So Mr. Gump, remember who was smart in that movie? He was smart and his mama was smart. Mama always gave him good advice. But he said, stupid is as stupid does. What do you expect when you you substitute iodine for bromine? Bromine's a toxic substance with no known value. All those halides, iodine, fluoride, and chlorine, compete with one another for absorption and receptor binding. And bromine interferes with iodine utilization in the thyroid as well as other areas of the body. It's a known goitrogen. It binds to wherever iodine binds to, the breast, the prostate, and the thyroid. Here's a new car showing huge amounts of bromine and chlorine coming out of the new car. That's part of that off-gassing. I had a patient who got sick from getting a new car, and it took a while till we figured out it was her new car. She was doing fine. She gets this new car, and all her symptoms come roaring back, severe fibromyalgia, migraine headaches, and we had her stabilized for 2 years. She goes to one of my lectures, sees the slide, comes up to me and goes, "It's my new car." So we tested her. She had very high bromine levels. We detoxed her with more salt, more iodine, and vitamin C and magnesium. Brought her bromine levels down and has done very well since then. What do you think she did with her new car? Sold it. She's a woman. She's not going to lose money on that car. What did she do with that car? Gave it to her husband. Of course, a woman's going to answer that question. Gave it to her husband and took his old car. That's our life. So, the halogens. Here's the molecular weight of the halogens. If you want to competitively inhibit iodine, which halogen are you going to use to most competitively inhibit iodine? Which one? No. Remember, competitively inhibit, you want the same structure, same size, the same close mimic to it. You're going to want the molecular weight as close to it. I agree fluorine's a problem. It's the most electronegative elements, and it's very highly reactive. But in this case, for competitive inhibition, bromine. So if we look at them, here's the oxidized forms of the halides. You can see this one most closely mimics that one. And that's what we're getting exposed to. That's what's occurring at epidemic rates right now. Animal studies show that bromine can adversely affect the accumulation of iodine in the thyroid and the skin, and high bromide intake results in iodine being eliminated from the thyroid gland and replaced by bromine. And ingestion of bromine has been shown to cause hypothyroidism in animals. And when iodine deficiency is present, the toxicity of bromine is accelerated in the body. Every one of my nearly 1,000 patients that I've checked for bromine has had high to toxic levels of bromine. Doesn't matter healthy, doesn't matter not healthy. I've been checking myself over the years. I eat a good diet. I exercise. I take iodine. I still have high levels of bromine in my body. It never comes down, I think, just from the world we live in right now. Bromine's an antibacterial agent for pools and hot tubs. It's fumigant for agriculture and sprayed on fruits and vegetables. It's fumigant for termites and other pests. In 1981, 6.3 million pounds were sprayed in California. It was up to 18.7 million pounds 10 years later. They won't release the numbers now. They were supposed to get rid of brominated pesticides in California, but they haven't done it yet. Bromine decreases sex drive and sperm count of mice, enhances estrogen receptors, downregulates progesterone receptors. That's certainly what I'm seeing in a lot of patients right now. And 33% fewer male births in women with the highest exposure to polybrominated diphenyl ethers and polychlorinated biphenyls. Pesticides contain organic bromine. The amount of bromine in human breast milk has increased tenfold over the last decade, while iodine levels have fallen 60%. Now, we need this serum concentration of iodine to achieve maximal transport, to achieve thyroid sufficiency of iodine. You can't get that at the RDA for iodine. I went through that with you in Minneapolis. It's impossible. However, milligram doses can do that, and 50 milligrams can reach that concentration in 3 to 6 months in a healthy person. So there's different amounts of iodine. The interesting part of this slide, the breasts have a minimum of 5 milligrams per day in a 110-pound woman for maintenance of normal breast tissue. However, a woman who's larger or a woman with larger breasts will have an increased requirement. Men have a slightly lower requirement because we don't have the breast tissue. But other glandular tissue are 2 milligrams per day. You can see that the RDA is just truly for rats. My acronym's true. Every cell in the body contains and utilizes iodine. We went through that slide. So how do you check iodine levels? You can do blood levels. You can do saliva levels. Skin testing where you rub it and see how long it takes for the iodine to go away is inaccurate. This study showed 80% of the iodine sublimated out to a gaseous phase. The best way is urinary excretion tests, an iodine loading test. Dr. Fletches does the tests. You can talk to him after his talk because I don't think he's talking about that. That's the best way to measure iodine levels. And these are the labs that do it. FFP Labs is Dr. Fletches' lab. Oh, by the way, I have no conflict of interest. I didn't read my statement. I have nothing to declare. No interest. So, adverse effects for iodine. People are worried about allergy. If you have a allergy to radioactive iodine, that means nothing of an allergy to inorganic, non-radioactive iodine. I rarely see someone with an allergy to iodine. There's an acupressure treatment, NAAT, that has been effective for that rare patient that has an allergy to it, but that's not very common. Autoimmune thyroid illness. I went through this with you in Minneapolis. Iodine deficiency causes autoimmune thyroid illness. Iodine replacement as part of a holistic treatment regimen treats autoimmune thyroiditis. Am I running out of time? Bueller? Anyone? How much time? 5 minutes. I want to take a few questions because I'm not going to be here for that panel either. I apologize. Iodine can cause detox reactions. You can get bromine, chloride, fluoride, mercury, and other things released into the body. However, proper nutritional support, keep the pH balance, eat a healthy diet, give liver support can help with that. Iodine-induced hypothyroidism doesn't exist. I don't want to talk about it because it irritates me because it's not true. Iodine-induced hyperthyroidism, yes. If you have an autonomously functioning nodule, that can occur with iodine replacement. It's very rare. I've had a few patients over the years. If someone gets hyper with the first dose of iodine, stop, give them more salt, give them more vitamin C, give them more magnesium, re-challenge them again in 3 weeks. The vast majority can take it. If they still react to it, at that point you got to stop and figure out, do they have an autonomously functioning nodule that needs to be removed? I've had 3 patients in about 10 years with that. Iotism, if it's an ism, it must be scary. Iotism is metallic taste in the mouth, increased salivation, sneezing, coryzia, frontal sinus headache, and acne. None of these are going to kill anybody. They're detox reactions from iodine, and I think iodism is the same as bromism, because all these can be bromism. I don't even know if iodism exists, but again, slow the dose down a little bit, more salt, more vitamin C, more magnesium, takes care of this in the vast majority of people. Thyroid cancer has gone up while iodine levels have declined. So minimize effects, use it as part of a holistic treatment regimen, balance vitamins and minerals, magnesium, salt. We went through this mechanism in Minneapolis, and vitamin C are very helpful for it. And hopefully I pronounce you guys cured of medical iodophobia. So keep in mind, iodine levels have fallen 50% in the last 30 years. During that same time, significant elevations of thyroid problems, autoimmune thyroid problems, thyroid cancer, breast cancer, and all the endocrine problems. If iodine were dangerous, these conditions would be going down. Start slow, check levels, follow patients closely, but most importantly, combine it with a holistic treatment regimen. And it's diet, vitamins, minerals, detox, and that's the best way to use it. St. George said discovery is consistent seeing what everybody else has seen and thinking what nobody has thought. That's why we're all here today. And I thank you for your time. I still got time for a few questions if you want.
If you're going to ask a question, please get the microphone from Farah.
How do you test for bromine?
You can do urinary excretion tests. Dr. Fletcher's lab will test for bromine, fluoride, and iodine.
Yes, how do you treat somebody that's already on a thyroid hormone?
So I call it the rule of thirds that happens. The rule of thirds is if they're already on thyroid hormone, a third of them will not need iodine. When you put people already in thyroid hormone and iodine, a third probably won't need thyroid hormone. A third will need to lower the thyroid dose in half, and a third will stay the same. The problem is I don't know who those thirds are once you start it. So I always counsel patients, be cautious. You might have to lower your thyroid dose when you go on iodine.
David, thanks for a great presentation. I had a question on the reactions that are reported sometimes to the iodine, the skin lesions and so forth. We've had someone spoke some years ago to us about that may be not a reaction to the iodine per se, but to the body dumping bromine as a result of getting the iodine levels back to where they should be. You want to comment on that?
I agree with that. Again, slow down the iodine a little bit, more salt, more water, vitamin C, magnesium is very helpful for that. Support the detox system. I don't find big problems with that at all.
Thanks again for a great presentation, too. Instead of using fluoride in our office, we use supersaturated potassium iodine and then have the patients brush with a couple drops a couple times a week. Is that a good absorbable form of iodine? And because we've noticed the decay just pretty much stops.
There's some old articles in the literatures. Dentists used to drip iodine onto the teeth. I think it's appropriate to, the only thing I would be concerned with is that there, you guys know this better than I do. There are some people with porous teeth who can absorb some of the iodine if you're giving them the oxidized form, and it can discolor their teeth until they get rid of that. The iodide you're using is clear. That won't do that. So I would say if you're getting good results, I wouldn't see any reason not to.
Hi, I would like to know how you treat Hashimoto disease or thyroid resection.
How you treat, what was the first one?
Hashimoto disease.
So Hashimoto's disease, Hashimoto's forms from low iodine. They need iodine, but they also need vitamin C, magnesium. Salt is a big deal for that, and B vitamins. And what was the second part of that question?
After the thyroid resection.
So if you've had your thyroid out, the question is, do you still need to take iodine? Well, do you have skin? Do you have heart? Do you have liver? Do you have kidney? All those tissues require iodine. The breasts require iodine, and such. So yes, you need iodine whether you have a thyroid or you don't have thyroid.
My question is, what is povidone, and what implications does it have to use it topically and so forth?
So it's topical iodine. It's used for skin cleaning before surgery and for wound healing. Some of that is absorbed, but in that one study, 80% of that sublimated off into a gaseous stage. I don't think it's a great way to get iodine into the body. Lugol's orally is fine. Iodoril's fine. Iodozyme, I have no financial interest with any of these companies. I don't own anything with them. But all those products, those are the 3 products I would recommend if you're going to use it.
Can you comment on the use of the iodine patch test with Lugol's?
The sublimates out. I don't think it's a great way to assess body iodine sufficiency. Urinary tests are better to do it.
Regarding urinary tests, I've done a good number of them in my practice, and I've only seen 2 patients in the last 10 years that actually have excretion of greater than 90%. I wonder if the percentages of finding a normal one are so low, why spend the money on the test and just assume that people are low in iodine to start with?
You're a doctor. That's why you got your doctor hat on, and you're thinking. And I don't disagree with that.
Thank you for being here today. Quick question. In dental school, I lost my thyroid, and so went from hyper to hypothyroidism, Hashimoto's. Ended up taking my thyroid out. Now I'm going to have to go through mercury detox. Iodine with mercury detoxification, does it increase the amount of iodine that you take? Any effect or any recommendations?
It helps some people with mercury detox. It doesn't help everyone. I did a study on that, and I found about 20% of people, iodine helped mercury push out of the body better, but in 80% it didn't do anything to it either way. So it's hit and miss on who it helps with mercury detox. You could take iodine while you're doing a mercury detox, but I would not rely on iodine solely to be your mercury detox. Well, thank you very much.